ladies? Yes. Okay, my name is Robert Johnson, and I'm the Safe Routes to Schools coordinator with Walk Bike Nashville. We've been in business since 1998, and we're the leading premier advocacy non-profit in Nashville for walking and cycling. And Safe Routes to Schools programming has been a key part of our programming right since the beginning. We've always had Safe Routes to Schools as a key element of what we do. We think it's tremendously important in Nashville. The 6 E's that are generally considered to apply to Safe Routes to Schools. E for engineering. We have not so much to do with engineering, but we're really interested in sidewalks, placements, where they go. We have excellent relationships with both the planning department and public works about what the infrastructure actually looks like out there. E for education, we go to schools and we do bike rodeos, road safety classes out on the playground and in the classroom, and that's what I spend most of my time doing, is the education. E for encouragement, we run bike to school day and walk to school day, which are fabulously popular, and they take up a lot of my time each year as well, and they're going really well. E for enforcement, liaising with where the crossing guards are and the police force, which is not just about enforcing speeds and parking spots, but also things like where the crossing guards are located in a long-term process and a systems and a policy aspect of that we're really interested in. E for evaluation, that's one of the key aspects of our grant application is we don't do enough evaluation. No one does enough evaluation, do they? But we don't do enough evaluation. So part of our grant focus here is because we're going to focus in on 4 schools, we really want to evaluate what the programs actually achieve at each of those schools. That's one of the things we're going to focus on. And then E for equity, we are working only with public schools. So we are definitely including the most disadvantaged people. The need that we think that Safe Routes to Schools can address, definitely that lack of physical exercise is what our program will be about. We're going to get out there and we're actually going to get the kids physically active and we're going to measure that. Calories burned, miles walked or cycled. Perception change as well. Obviously a fear of road traffic is one of the key barriers to more walking and cycling. But how much of that is down to the actual infrastructure and how much of that is down to a perception of fear that can be overcome, perhaps by going a different route or having a crossing guard moved. That stuff we actually want to do perception surveys and again get a bit more in detail on the measurement than has previously been the case with Safe Routes to Schools in Nashville. 37% of Davidson County school children are overweight or obese, but the really bad news is that, of course, is the average figure. I've been doing some research for this presentation. East Nashville Middle School, in one of the oldest neighborhoods, excellent sidewalk network, excellent grid pattern of streets, 40% of the middle schoolers are obese. Lytton Middle School, which is not out in the country. I mean, Lytton Middle School is suburban, but it's not out in the country. I mean, the sidewalks are not so good. Is the worst school in Nashville. 65%, 2/3 of the students are currently obese or overweight. Really shocking to me, particularly as a Brit. The upper respiratory diseases, as you know, not getting any better. 10% of Davidson County children have asthma at the moment. And then the big silent killer that no one wants to talk about is the traffic crashes. And of course, again, we'd address that directly in terms of road safety education to the children, talking to the police, including the community in what we do. Someone's killed every day, a pedestrian is killed every day in Nashville, and of course children are particularly in the risk category. They're overrepresented in that one pedestrian every day being killed. School children overrepresented in that. And then neighbourhood cohesion, not something that everybody thinks about in terms of walking and cycling to school, but simply being out there on the streets is good for you and it's good for your community. There is a study that shows the number of friends you have on your block is directly inversely correlated with how busy your street is and how many traffic lanes there are on that street. So literally, if your street is too dangerous to cross, then you're not going to go and visit your next door neighbour. And studies have been done to show that. So what we think our solution is going to be in the Safe Routes to Schools program we'd love you to help us with is we will focus on 4 schools. We reckon we can get a spread of different kinds of school like that. Urban, suburban, maybe particularly disadvantaged, and some of the ones where the kids have got a bit more freedom and the parents have got a bit more options. We will use body mass index from MNPS. They record body mass index every other year. So we've got body mass index numbers, and we'll use those directly as a correlation for schools that need more physical activity. We reckon relating body mass index to the need for more physical activity is a pretty good correlation. We'll also look at the infrastructure around the schools. To be honest with you, it is true to say that there are schools where it's too dangerous to walk and cycle to school. It's a sad thing for me to say that, but it's actually true. So we are going to want to use schools where we can get some results. So I'm afraid we are going to be looking at the infrastructure that exists and how enthusiastic the school team is now, because we just don't want to choose places where we expend all our effort for absolutely no measurable gain, I'm afraid. We and ahhed about that a lot, but we will be using the existing infrastructure and the staff support as one of our measuring characteristics for choosing those 4 very different schools. Then what we want to do is, having done that, we'll go into those schools and find the healthy school team. You know, the Office of Coordinated School Health has a healthy school team network across all of the schools. Their activation levels are kind of different at each school, but they have a healthy school team. We want to go in there, be the experts, bring them up to speed on safe routes to schools, and try to use them as our method of talking to the community and getting buy-in from everybody, parents, students, school level, and indeed at the headquarters level of MNPS, and then the partnerships outside, aftercare providers, other non-profits, bike clubs and that. We want to use the healthy school team as the focus at each of the 4 schools that we focus on. Use them to tell us what programs are context appropriate, what programs are culturally appropriate for us to do. And then we'll do all sorts of programming. We've got national best practice. There's not a shortage of what programs you should be doing. A walking school bus, so I had some fun with a walking school bus there last year. Bike buses, a little more specialist because you're cycling on the road, and so you're talking about road rules. But a mileage club, competitions, grade versus grade, classroom versus classroom, even school versus school we could do. A lot of motivation behind competitions to do more physical activity. We would go out and do walking audits. Perhaps that would be something the pupils would do, is go out and do walking audits. There's a bunch of different programs around encouragement and educating people to do more walking and cycling. It's just a question of which is appropriate, and then can we measure it? Can we actually measure the outcomes at these different schools? So maybe at one school it's culturally inappropriate for girls to be walking on their own. Maybe at another school everybody loves cycling. We will use the healthy school team to discover those things, tailor the programs, make it local, and then actually measure the results. All things that the individual schools can't really do on their own. I wanted to, rather than go on and on about all the millions of programs that I love running, I wanted to come back to where I thought the alignment were with your goals. So the 3 top chip goals that I see: health equity. I mentioned we're already working, it would be only public schools. So we'd definitely be including the lowest income and the most disadvantaged children. Walking and biking are inherently cheaper than the alternative of being in your own car, if not cheaper than actually riding a public bus, give or take the free bus passes they've got now. But nonetheless, we think we're encouraging people to go for a cheaper option with walking and cycling. And of course, low barriers to entry. Walking has got no barriers to entry. Cycling, you do have to have the ability to cycle and the bike. But the walking, even if you can't read, you've just arrived, you haven't got any money, and you can't read or write English, you could still enjoy walking to school and get all the benefits from it. Maximising the built and natural environment. As I said before, we will use our expertise in the healthy school teams and our existing relationships with planning and public works to start listing out what the defects are, what the problems are in the community, and what the solutions can be. None of this stuff is unknown, it's just not prioritised. They don't have the resources, and we don't currently focus in on that way because there's me trying to serve the whole of MNPS. So what we want to do with this programme is the focus, the healthy school team integration, and the measuring of data, I think, are the key differences between what I do at the moment. The natural environment, obviously we think walking and cycling is just inherently better for the environment than car use. We really do believe that. And then priority 3, walking to school with elementary school children is valuable family time. Lots of people report that. I actually like walking. I actually walk to school and I really enjoyed talking to my children. They're not in a metal box, they're not distracted, they're not strapped in. They're meeting their neighbours and just waving at people on the street. A number of people have reported to us that that was a whole benefit they were not expecting from walking to school. And of course, once you get to the middle schoolers, it's actually independence. The middle schoolers can cycle themselves down quiet streets to school. They've never done anything like that before. This is their first taste of independence. And again, I've met a number of kids who are like, yeah, my mum and dad let me cycle to school now after I went on your training. After I showed my mum and dad that YouTube video of you or whatever, I now cycle on my own. And that's a big deal for them. Turning to your actual grant application, I'm a bit of a planning nerd. I actually like reviewing policy documents and I actually like reviewing development proposals. So I managed to persuade my boss to include in here, again, starting from the bottom up with the actual principal of each school and the healthy school team, I wanted to review all of the policies that might touch on safe routes to schools and use the healthy school team to drive what that policy is causing a problem at their individual school. At the moment, I kind of skim across the surface of this, but I think with the support from the local school, healthy school team, I'll do a lot better at persuading the senior level staff how there are problems. And there is good work already. Open access, there's a lot of shared use, or I think there's 100% shared use between MNPS and the Parks Department. I think all school playgrounds are open for the Parks Department. So there already is some safe routes to schools, some good physical activity coordination going on there between MNPS and Parks. Dismissal procedures. Some schools already prioritise allowing walkers and cyclists to be dismissed first before car riders, which has a twofold effect. One, it gives the walkers and cyclists the idea that they are a legitimate mode of transport and in fact that they're superior to the car riders. They can leave school first. Two, of course, getting them out across the grass, onto the sidewalk and across that first crosswalk where the crossing guard is before any cars start to move has actual safety benefits. As I said, we do have a good relationship with other departments. I want to deepen my relationship, particularly with the Transportation Department and the Security Department of MNPS. The Facilities Department are brilliant. The Chief Architect there, David Profit, is the Chief Architect of MNPS, and he already thinks about safe routes to school stuff when he's designing his sidewalks and whatever, but I know there are other stakeholders who I could, if I had the support of the locals, I feel I could do better with. There. I said we already have a good relationship with Metro Planning and Public Works. We already do review developments for whether they're bike friendly or not. So I think that's a relationship I could deepen if I could focus on just those schools. And then the action plans. These healthy school teams, in order to make the project a little bit more sustainable after the end of the 1 year funding, we would present an actual document to the healthy school team and be like, okay, this is what we did and how it worked, and we evaluated the programs and we think these are great programs for you to take forward. But on the infrastructure side, which is going to take more than 1 year, here's what we, Walk Bike Nashville's experts, think should happen. Here's where you want a crosswalk. Here's where you should have flashing beacons. This should be your sidewalk priority because we noticed these patterns or whatever. We're going to give them activity plan, and at the end of the year, hopefully we can galvanise the healthy school team during the year, and here's a school travel plan that enable you to go away, and this is what you could work on next year, even if we're unable to continue our project. And then, yeah, looking at the two key funding objectives you gave us here in the grant proposal document. In terms of cross-sector collaboration, I think I've mentioned everybody there. We already do a lot of stuff with the libraries and the community centres. We do a lot of programming there. And the transport from one to the other, there are some walking school buses already in Nashville where kids are being walked from the school to the community centre or the library because of the after-school programming those agencies have. And again, having the depth to go to those schools would be really cool to get those more walking school buses going. Aftercare and club providers, gotta love the Edge Hill Bike Club with Terry Key there. The YMCA, we already do some stuff with the Family Resource Centre. So I feel like, again, with the idea of having this focus and then being able to measure stuff, I'd be able to have a better attempt at persuading these guys that, hold on a second, you do have an impact on walking and cycling to school. And if we provide the expertise, you've got the pupils, you've got the parents, you've got the neighbourhood connections. That was the cross-sector, yeah. Yeah, so It's not just a walk, it's a workout. I was like, that slide has been waiting for this presentation. Surely it has. So yeah, I think that's a walk to school day 2014 or something or other, and suddenly that picture popped up to me while I was doing the presentation. I was like, yes! It's not just a walk, it's a workout. So there you go. I tried to squeeze it all into 10 minutes and I get excited, so I'm sorry if I put in a lot of facts. But there we go, that's it.